What's up today, guys? Back at the RT Clinic, and today we got a special video about AVAPS, a common mode used on these Respironics V60s. So before we start anything else, we got to do the intro. Talk a little bit about AVAPS. That is AVAPS. That's the acronym for it. That's average volume assured pressure support. So it's exactly like it says. You're going to be given an average tidal volume. This is not a tidal volume that you'd see in volume control ventilation. And remember, one of the things that I always talk about with one of these machines, this is only to augment somebody's spontaneous tidal volume. Never used to augment somebody's rate. That is what a mechanical ventilator is for. So we have average volume assured pressure support. So your patient is always going to get pressure support. But what's going to happen if we go back and look at some other videos about how non-invasive STD BiPAP is used, we're going to have two set IPAPs, and that's going to be a range. And the machine is going to move back and forth, increase IPAP or decrease IPAP in that range to hit the targeted tidal volume. So let's get it started. I'll show you how it works. Of course, the on button's here. I'm going to be adding in my trusty test lung today. This is pretty small, so you're going to notice my volumes are going to be small that I'm going to deliver. These won't be the standard volumes that you're going to see on your patient, but we're going to downsize them just for my test lung so it's not alarming constantly. So when the machine first comes up, you're going to see an informational message. Like any of these machines, you need to go into the machine and say what type of mask you're using and what type of expiratory valve you're using. See, in this case, this is nice RT tape job on my lung here, you see. But this is a whisper valve. So you're going to see that's where the patient is exhaling from. You don't want to occlude that if it was a real patient. So we're going to go and do that. And let's say we're using Phillips masks. We're going to use mask number 1. So you always want to do this because that's how it's going to calculate leak. You probably remember on the old Visions we used to calculate leak and have a patient leak and a total leak and all that kind of stuff. So let's go into menu. We're going to go to mask port. Number 1, accept. And then we have multiple different, that's a whisper swivel. I call that a whisper valve. But this is really the Respironics disposable exhalation port. That's what we're using today. So what it is and accept. So that gets rid of that message. So the first thing we want to think about doing is, I'm going to go back to settings here. On our settings, we want to kind of set this up for our patient. So we need to know some specific things. Now, we don't commonly put tidal volumes into non-invasive ventilation, but with AVAPS you're going to. So you're going to have to calculate their ideal body weight, which is super fun. Or I'll give you a kind of a quick way to go. And then we're going to put in a tidal volume for them based upon their ideal body weight. We're going to use 8 milliliters per kilogram for ideal body weight. So it's super simple. I'm going to show you a little quick thing that you can use. You can use this for testing also. Now I'm using pounds. I know most of the medical world uses kilograms, but I'm kind of old school in that way. So I'm going to use pounds and show you a quick way to convert it. Here we go. We're back. And quick way to calculate ideal body weight. So I just ran these calculations through real quick. Look at the correlation between these. These are in pounds, ideal body weight, and how ideal body weight's figured by are you male or female and how tall you are, because that's where we're really looking at your thoracic cavity, the amount of volume in your thoracic cavity that we're looking for. So you see 125 pounds, 150, 175, 200 pounds. So these are a good generalization for ideal body weights. So if you look at 8 milliliters per kilogram ideal body weight, you see 125 is the 8 milliliters per kilogram ideal body weight. In this case would be 454 milliliters. 150 up by 25, by 25, by 25. You see the pounds there. 545, 175, 636, and then 200, 727. So where's the correlation there? Well, if you know 125 is 454, then as you go up each time, you take your number in the tens position and go down. So you're 5, 4, 3, 2, and you just say 454, 545, 636, and 727. So those are kind of nice if you have to really estimate something on the fly. But in this case today, we're actually going to put in a low tidal volume. So I'm going to put one in about 300 or so just for my test lung. Okay, so let's put in our settings. Right now I have it run on the test lung, but we're going to go in AVAPS settings. We see I have a tidal volume of 400. We're going to start at actually 300. We're going to go down with that. Accept. We're going to do a low rate, so it's really important, like I said before, this is not to augment their rate, this is to augment their tidal volume. So I always start usually 8 to 10, so we're going to leave it at 10. We'll leave our I time at 1, our rise time at 4. We're not going to mess with those right now. Our EPAP is kind of standard, so our standard that we use is usually IPAP of 12, EPAP of 6. We're going to leave that EPAP of 6, but we're going to set, you see these are a little different here. We have a min P and a max P. This is going to be our area where this is going to titrate between these two pressures to try to reach this average volume. Now, the key is it's going to titrate slow, and I'll show you that a little bit. Now, if we look up here at our graphics, this is something else that I don't like. You see this graphics, you really can't see much from them. So I always like to go in and to adjust these graphics. Make it out as long as you can. That's a total 24 seconds there. Of course, we have these are our scalar waveforms, pressure on the top, flow in the middle, and volume on the bottom, like you commonly see. So you see these are kind of orange as they go up. These are all machine delivered breaths. Okay, patient is not triggering these at all. If the patient would trigger, I'll show you what would happen with that. There you go. We kind of got that turquoise looking color there. And you can see the initial flow drop catches up on that and then gives the volume. So, and then it's going to go back to giving machine breaths. So, if we're going to look forward with this, we see that right now our exhaled tidal volume is about 358. We have an average minute ventilation of 4.1, and our peak pressure is 22. And you say, well, what the heck? Why does that 22 when I started at 12/6 and I just started the thing up? Well, there's a special calculation that the machine starts at and uses one of 3 numbers. So what it's going to use, it's going to use this calculation when we initially start up. So to get the initial IPAP, it's going to use a few different ones. In some cases, it's going to use IPAP minimum. Well, that was 12, and that's not where we would have started this time. You can see it's up to 22 right now, but this is because it's been running for a little bit. It's actually slowly got up to where it is now trying to shoot for that 300 range. You can see settings, patient value here. The other one is tidal volume divided by 60 plus EPAP. Well, in this case, tidal volume is 300 divided by 60 is 5, plus EPAP is 11. That is not the higher of these numbers. And that's really what it's going to look at. It's going to say which one of these is higher, and that's where it's going to start. The next one is EPAP plus 8. So EPAP of 6 plus 8 would be 14. So that's where our inspiratory pressure started. So it will start at that level. This one is the highest calculation. That's where it will start. So it started at 14 and now it's slowly titrated up. Now, it will not titrate more than 2.5 centimeters of water pressure per minute. So you're like, whoa, that doesn't seem right. It started at 14, but they actually need 23 to reach this? Yes, and that's the really important thing, that this is not an acute care type of mode. This is much more of a management type of mode for patients. Although it will adjust that pressure support, but it does it very slow. So if you want to compare it to something, I like to kind of think of it, this isn't the CO2 on your blood gas, this is more like the bicarb. So it's going to move slow and try to keep up. So it's really important that you don't use this for somebody that is in acute respiratory failure, okay? You might put them in STD. In that case, you ST on this one is what it is. So spontaneous timed mode in that case. So AVAPS is really good for a few things. Neurological disorders. It's really good for a COPD patient that wears BiPAP at night to keep them from hypoventilating at night. It's also good for obesity, hypoventilation. Those are all really good uses for this because it's going to move that pressure and it's not going to blast them with a lot of pressure each time if they don't need it. And remember, this is only to augment their spontaneous tidal volume. This is not to augment their rate. I can't say that enough. So taking somebody on AVAPS and cranking their rate up because they're hypoventilated is not what you want to do. So if you draw blood gas and they're acidotic and their CO2 is high, this is not the way to fix them. Go in here and start going like this, messing with this. One quick way that you can do it, flip them to ST mode, give them a higher pressure, because you see what happens right now, the stuff isn't changing real quick, and I'll show you that in a second. But you can go to ST mode, but you probably need to think about a mechanical ventilator if they are having acidotic blood gas on one of these machines. So let's go back to AVAPS real quick. I'm going to take that rate down to something normal here. Okay, now I'm going to show you how slow this changes. So I want you to notice something on the machine, and then I'll speed the time up a little bit as we go forward. So I'm going to go up on my volume. So you're going to see this slowly increase volume. I might take my Pmax up just a little bit because my test lung's real tight. So, all right, here we go. We're going to go 400. 380. So watch how slow this is going to increase. Ready, go. And remember, it will not go up more than 2.5 centimeters of water pressure every minute. So you're going to see this slowly start to creep. So we'll speed it up. All right, so we're really close to being there now. You see we're near 400. Our inspiratory pressure is at 26. So the max is going to be 30. So it went from 22, 23 up to 26. It moved up pretty quickly, which I'm really happy with. If we went up a lot more in volume, we might have some more problems. But you're going to see what's going to happen now. You see our waveforms are outside of scale. I can bring those back down to scale so that we can see what's going on. So you can see it right now. It's delivering around 424. And we have a set of 380, so it's just a little bit above. Inspiratory pressure of 26. It got there pretty quick, so I was pretty happy with it. So right now, of course, the other things you're looking at, if you have your patient trigger, patient's not triggering much at all because it's a test lung. We have our rate, which is what we have set. And that is really how it works. So it's going to remember it's going to move really slowly up and down to get that target tidal volume. So we're just a little above it right now, but in the case of non-invasive ventilation, that's not going to be a problem at all. I hope this was helpful today, guys. Make sure you comment in the bottom, like, subscribe, send to your compadres, and we'll have some more videos coming at you from the RT Clinic. Thanks.